This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Pregcert AQ 25 mg injection is essential for maintaining early pregnancy in women with specific health challenges. This medication supports those facing repeated miscarriages and assists in reproductive techniques. Indications and uses. This injection is indicated for maintaining early pregnancy in patients who have experienced recurrent miscarriages due to luteal phase defects. It is beneficial as an adjunct in assisted reproductive technologies like IVF and GIFT, facilitating successful implantation of the fertilized egg. Additionally, it helps manage threatened abortions and abnormal uterine bleeding resulting from hormonal imbalances. It can also serve as a diagnostic tool in progesterone withdrawal testing to diagnose endocrinal issues related to secondary amenorrhea among infertile women. How it works. This injection works by supplementing the body with progesterone, crucial for the successful implantation of a fertilized egg and maintaining early pregnancy. Directions for use. Pregcert AQ 25 mg injection should only be administered by a qualified healthcare professional, either intramuscularly or subcutaneously. The healthcare provider will determine the appropriate dosage and duration tailored to the patient's age, body weight, and medical condition. Possible side effects. Common side effects may include pain, redness, or irritation at the injection site, headaches, nausea, and mood changes. It's crucial to consult a doctor if any of these effects become bothersome. Precautions and warnings. Before using this injection, it is essential to discuss any pre-existing conditions with a healthcare provider, especially liver, kidney, or heart issues. It is contraindicated in patients with a history of certain cancers, blood clot problems, or those who are breastfeeding and under 18 years. FAQs. 1. Does this injection cause weight gain? Yes, it may cause weight gain in some individuals. 2. How is it administered? Only a healthcare professional will administer it intramuscularly. 3. Who should avoid it? Patients with ectopic pregnancy, certain cancers, or severe liver issues should avoid it. 4. Why is it necessary for pregnancy? It ensures adequate progesterone levels for implantation and early pregnancy maintenance. 5. What are the common side effects? Injection site reactions, stomach pain, and hair changes are common. Thank you for watching. If you have any questions or suggestions, please leave a comment below, and don't forget to subscribe for more updates.